Hi, Tyler. Good to see you.
What's up? Thanks. Good to see you as well.
Great to have you on the show. To kick off, would love to hear a bit about who you are, what do you do, where you're from, and then what did you have for breakfast today?
Oh, dang. It's kind of nice to not be on just a climbing podcast because talk about finger stuff so much that it's going to be quite relaxing in some ways to not talk about finger strength training and injuries. So thanks, thanks for the invite. So a little bit about me, like I went to undergrad at the University of Utah where I live, and then did like a double bachelor's degree. I was interested in cultural anthropology and then human biology, and then had a bunch of different avenues I was going to take with grad school, and then ended up going to chiropractic school because I had a father that worked at a school, and I got like pretty much to go with no tuition costs, which was like pretty amazing. Because where I live in the state is like pretty good scope of practice for conservative stuff because it was either that or going to PT school, but that made more sense like financially because like nowadays the difference isn't that dramatic with modern chiropractic schools and PTs. Like if you saw them in the room with a patient, you wouldn't really be able to tell who's which because there's a lot of crossover. So I did that in Missouri, and then at the same time I did a master's degree in exercise science, and was just like for some reason super interested in tendon loading and adaptation, and like because there's not that much research on it in science, and so I kind of just got interested in that kind of avenue, and then did my master's kind of finish at the University of Missouri, where with the football team, Mizzou helped them, and so I got a lot of exposure to the sports science side of exercise science from there as well. And then since then, I've just been kind of clinically in Utah and just like working with rock climbers. Like it wasn't always working with only rock climbers, but the last 4 years has been almost exclusively working with rock climbers.
And what did you have for breakfast?
Oh, what did I have? I had I wish that I had a donut. I'm way into donuts, and in the climbing world, people kind of know me. And, some toast with the way that I like to make it, which I think is really good, is like toast with honey butter, and then I use like from Trader Joe's like an everything bagel seasoning, so it's like salty, but I will put that on it too, and then 2 eggs that were flat with like cheese on top as just like a flat breakfast sandwich, not together. I think it's too much together, but individual, I guess what they're called open-ended sandwiches like that. That's kind of my go-to breakfast. It's pretty fast.
Got it.
Nutrient enough. Well, what about you?
Sounds like a strong you have strong breakfast, strong sandwich game to be precise. I had a bowl of this multi-seed thing that I make with steel-cut oats and hemp seeds and chia, and then I just cook them with any kind of nut milk I have, and then I top it up with avocado and something to sweeten up, like bananas works well, and I find that I'm full for like many hours.
That's great. I like the steel-cut oats a lot. I don't like how long they take to cook though. It takes forever. Right?
We could talk about this for a while, but I have this Instapot.
Oh. I need
to cook it and you forget it. Yeah, you leave it. I take the dog for a walk. I come back and the
food is ready. Because like 30 minutes, I'm kind of in a hustle, not like it's kind of a bad habit. It's kind of like a nurtured habit. My dad's very much like that, very much like just getting a lot done, always moving, which has good things, but it has downsides too. And so I don't take time to like sit and enjoy my breakfast, which maybe end the run of my life I'll regret that, but like that's not how I operate. So the 30-minute time frame is always like I gotta go. So this other thing takes 5 minutes, right? So it's like faster.
Yeah.
You love that breakfast. That's the choice. I like that for sure.
Yeah, no, it certainly takes 20-ish minutes. But it's mostly because I can just let it cook and then disappear.
Right.
And then when I come back, I can just eat it right out of the breakfast bowl. Tyler, you have certainly moved on from your, your master's work in working with footballers. And me, like many others, are avid consumers of the excellent content you put out on the web through your Insta and others. And there's so much science and thought and planning that you put into your into your studies that you share with us. How did you move from working with footballers into working with rock climbers, or let's say broadly outdoor athletes, and how's that transition been, and what's the feedback that you've gotten?
Yeah, I think the transition was mostly just I was interested in climbing, so I got into climbing in college and undergrad, and then by the time I went to grad school, I was like way into climbing already, and I went to grad school later, so I think, how old was I? I was maybe 27 when I started grad school, and so in college, that was like, maybe not 10 years, it was maybe 6 years of like pretty focused climbing stuff, and I was like trad climbing and big wall climbing, which I love the most. And so I was kind of always into it with the intent of coming out and like working with climbers because I like the community and I like the sport, and just like then when I was in graduate school, it was the real hard understanding that, wow, we're like kind of behind, right? And if you look at like a college football weight room facility and the staff they have and the teams and the money and all the things, like it's bananas how not like up to date climbing training is in relation to something like that. And obviously there's a big money difference and all that matters, but like there's just been way more exposure over the years, and those sports had their same kind of, let's say, slow builds of what's considered normal with training stuff, So coming out of school, I like had a clinic, and as a chiropractor, like the kind of open your door cliche thing you get is like a bunch of people that want a physical service, and they expect to leave after this physical thing, and it's gonna like fix their problem, and that just never made sense to me. And so really, like the first 2 years of my education were really like pathophysiology and neurology and anatomy. That stuff I just like consumed a lot of and studied a lot and was way psyched about. The second half of my education was kind of like the stuff that I was not that interested in, other than like the rehab, loading, strength conditioning stuff, but all the other manipulative stuff and all the typical chiropractic stuff, I don't, there's not there's like, it's a long story, but like I'm not as into that as a therapeutic intervention. I would consider myself more of as an educator, and that's essentially what physios and chiros and doctors do. They educate people on lifestyle choices and maybe try this instead of this and navigate this, right? And in the realm of like sports injuries, that's pretty much what people do. All of the other physical passive things that can be applied to a person are sensory changes. They're not really fixes, So kind of had that kind of in the background as like a philosophical difference maybe with like what I was going to do for my job. So I actually didn't like having a in-person clinic because, and not that I don't like to communicate with people, because I do, but when people come into an office, they expect to get some service, and they don't want to like sit and talk with you and like learn about how they can help themselves, right? And so like I always found that kind of a challenge to connect with people and have them take it upon themselves to help them, to like fix their problem or help themselves. And so then I went to mostly a virtual kind of business, which now I actually get a lot more enjoyment out of. And I don't know if that answered your question originally, but
it does, and it leaves me with a couple of breadcrumbs to come back to later. But one question, yes, I should ask you is, can you describe what is it that you do today, and how do you help athletes? You talked about a virtual practice. What is that all about, and any other things that you do?
Yeah, so like in my office, like in the state of Utah, like I have a pretty broad scope of practice. So like in terms of a chiropractic physician in Utah compared to like a medical doctor, I have the same diagnostic ability, the same ability to order images, can order blood work, like etc. I cannot prescribe medication, and I cannot do injections of things that are not like autologous to the person. So I could do PRP injections, which I don't do because they're not effective. But like I can't do injections or prescribe medication, but aside from that, the scope of practice is very similar. Granted, like the difference between healthcare providers is, medical doctors go and they do a specialty and they're expert in one particular thing, right? And so like for me, like I had a pretty like solid anatomy background and really good like connective tissue, tendon adaptation, rehab background. And so finger injuries are really common in climbers. And so the majority of what I do now when people come into my office is I do diagnostic ultrasounds on fingers. And so it requires a really small diagnostic like probe. It's a really small, called a hockey stick probe. And I will do diagnostic ultrasound imaging and do rehab program design pretty much. So that's like the in-person business, and then the remote business is that same thing, but we just talk virtually, and sometimes I will have them get imaging done elsewhere.
Awesome. Thanks for sharing that. And I think a lot of people do benefit from a lot of the free programming that you share as well from your social feeds. Getting back to working with different kinds of athletes, a lot of the focus of the show is teasing out some of the improvements, the wisdom, and kind of guidelines that have evolved on how to help older athletes keep performing as they get older in years, but not so much in desired performance and longevity of their athletic career. What are some of the most common questions and say performance complaints you get from older athletes?
So I would say older athletes, the good thing about having a pretty deep understanding of what the science suggests is the cause of repetitive injuries, which are like golfer's elbow, tennis elbow, patellofemoral knee pain, Achilles tendonitis, shoulder tendinopathies, like all of like I have a pretty good understanding of those things. I've spent a lot of time like researching those and like staying up to date. It's not as complicated as most people think that it is based on the pain that they have, and like as we like age and we continue to be athletic, those small like tissue tears and the arthritic changes and the bone spurs and the cartilage degeneration and the discs thinning, like all those things are now considered pretty normal for a human. Like if you're walking upright for 50 years, 45 years, like you're going to have some wear and tear on your body. That's like pretty par for the course. And so I would say we can use a lot of the of the understanding of what we do know about the science to apply it to a whole bunch of different things. It's not always a direct, one-to-one comparison relationship, but it's like we can extrapolate quite a bit and successfully. So I think the number one question that I probably get is, can I still perform my sport? And the number one like limiter that I will see is people will notice they will still be able to participate, but they will lose power output. So the connective tissue injuries, like the tendon-based injuries, or what appear to be tendon-based injuries, limit performance, not participation. So people don't have that high-end power output. They're not performing it as hard as they can or think they should, but they're still doing their thing.
Wanted to double click on that for a second about being able to perform, but maybe not at the same standard that person might be accustomed to. It's interesting that some of the people I've been speaking to, some athletes who are in their 50s, 60s, and even 70s, some of them have actually seen performance gains in those later years. And actually, this I'm talking both surfers and climbers. And one thing that I'm understanding is some of these athletes have approached, let's say, non-conventional advice for training at older ages, such as getting on system boards and training for power and doing things that you don't normally see older climbers do. So wanted to hear your opinion on how some of these people are able to actually utilize modern demanding training apparatus and keep improving in those later years. And some of these are, I would say, more elite athletes. What are some of the lessons that we could glean for like the more average person out there who is also getting older, might also have some injuries, but wants to not back down and try to get whatever improvement they can?
So I think with maybe what I said previously is in the context of people that I talk to that have pain complaints. So typically people that will have pain complaints will have a performance loss with their sport for a period of time until it's managed. But I absolutely agree with you. That doesn't mean that athletes can't continue to progress in their sport. And that's been my experience as well. And I think the easiest way to think about how that's possible is most people that are older in years and they're participating in their sport, they have other shit going on in their life. They like have a job and family, and they like are not obsessed with just like doing obnoxious training volumes. Like they literally can have a better training program and they just recover better. They have better quality food, they have better quality sleep habits. Like all of those things allow athletes to recover better from their workouts. And the addition of new things like a moon board or something, or the tension board, to increase your power output, that's not risky at all for someone that has a climbing background. And it's really just giving them that little extra effort during their session. And as long as they don't have too frequent sessions and they're pretty low volume, they'll only just get better because they've already put in a lot of the physical loading requirements over the years to allow their connective tissues to adapt and tolerate that high stress stuff. They've already like put in all the groundwork and the framework for increasing their performance, but now they're recovering more from it and they see those performance improvements, which is very cool.
Absolutely. No, I love that. And you're right. One should separate out these two tracks, which is the injury prevention and the injury rehab track. And the second being the training and the performance improvement track. And I think you provide services in both arenas. I personally benefited from the training end of your services because I worked with you a little bit last year to get on a training plan myself. Unfortunately, my training got a little ended prematurely because I got injured, and then I've been working more on rehabbing from injuries. And at some point, I hope to get back on a more structured training regimen. Getting back, actually, let's talk a little bit about injuries first. On the injury spectrum, can you help us understand, what is let's say good pain versus what is bad pain? Because I think a lot of us, because we love our sport so much, we keep doing the training, keep doing the sport, despite feeling pain, despite feeling soreness, and where somebody else might have stopped. So I think there are maybe some kinds of fatigue / pain / soreness where one should maybe try to push through, and perhaps there's some other kinds of pain where if you push your body to do certain things, you might actually exacerbate the condition and cause, let's say, harm that's harder to recover from.
Yeah, I think maybe one other thing to add, from a couple of things you said before, is like the strength training and the rehab. Like I think it's important for people to know that they're like the same thing, pretty much. Like I usually tell people that a deload or a program like time off or weeks to months off is a really good time to do strength training. And so the reason that like my business is more catered to athletes that have pain complaints, maybe they have acute injuries, but mostly it's pain complaints, they need to restructure their whole training program. I don't just like need to give them a bunch of random things to do. And so the biggest, I'd say, like waste of people's time, in my opinion, is to be able to go into a clinic like people did to mine when I first had an office and get some physical service to their body. And then the majority of the time spent is doing that thing. But then they leave. I didn't really help that person all that much. I told them as much as I could, but they weren't really focused on that, right? And so it's really about like actually being more comprehensive with the person in front of you and understanding what their life is like and what they do. And then all we need to do is we have to adjust all the things though. Like we can't just like give them stuff to do, which is kind of confusing because a lot of people when they have an injury, they think I need to do rehab, but then rehab to them in their mind kind of looks like low intensity, range of motion, lots of passive stretching, like all the things that like there's not science to support that those things are helpful in the context of getting or necessary to getting an athlete back to what they're doing. They can be used as stepping stones for people with a lot of sensitivity, but that's not my clientele. Most of my clientele are people that are doing too much. And if I give someone that's doing too much more stuff to do without taking away a bunch of stuff, that's not really helping them. That's kind of a waste of their time. Right. So I want to make sure we add that in because I think that's really confusing for people in general. They think rehab is like low intensity, easy, range of motion, etc. Right. But it can be strength training. And there's plenty of evidence to support that strength training is the closest thing to a miracle cure as we have for the aging athlete or pain complaints. It's not a miracle cure by any means, and every person is different, but it's pretty much the closest thing that we have as far as we know, with just like general well-being and and then oh, go ahead.
No, absolutely. And I think this is one of those things that I try to even tell my parents and people of their generation that, as older athletes or just older humans, one thing that does go out of control is muscle loss. As one gets older, exponentially lose more muscle. And one of the more sure shot methods to combat is strength training with not with sissy weights but with heavy weights. One other question, so going back to sort of understanding pain, let's say I went out for a run, I come back, I have knee pain, right? And then that pain causes me to stop, and now I have to limp back home. I wake up the next day, I may still have pain, I may not have pain. So what are maybe some things we can listen to inform us whether the pain we had requires us to either go see a doctor, or the pain is, let's say, more just the body reacting to stress, to a long run, and we should do something different to get back to form, and it's not really an injury?
I think, and that was great that you kind of interject again, because I forgot the question because I kind of went off on a tangent, so sorry. But like, I think I like to teach people that there's not really such a thing as good pain. Like, we kind of made that term up because we want to be stubborn doing the stuff that we don't want to stop doing because of a pain complaint, assuming that you have to feel pain to know that you're doing the right thing. That's not true either. There's good reason to maybe push into a little bit of pain to know that it's okay, but that doesn't mean that you have to do that every time to make pain go away either. So another thing, when you mentioned like, when something pops up, so let's say you're out running and your knee gets sore, right? It's not likely that it's that run that actually made your knee sore. Maybe you landed weird and you twisted it, whatever. But when I talk to my athletes on a call, I say, well, tell me what you've been doing the last couple months. And every single time there has been a sharp increase in some load, either a new load or the original load, beyond the athlete's current capacity to adapt to that load. So that injury did not happen that day, even though they felt it. So your knee injury didn't happen that day, even though you felt it that day. It had been coming on for months of time usually. And it always is attributed to something in their life, right? Maybe it's physical load, maybe it's work stress, maybe it's moving, maybe it's not sleeping. Like, it's not a simple thing to really pinpoint or nail down to one thing, but the physical loading is the easiest thing to manage. And so if athlete goes on a run and they're sore, like the next day they're sore again, you have to find a dosage of load that they can do where they break that behavior or that outcome where the next day they have pain, because that becomes an expectation for the athlete. And if that becomes the expectation, then that becomes the problem in itself in some cases. And so I would say for runners, like the kind of the like knee-jerk reaction for runners is like, okay, cool, you love doing long distance, low intensity, kind of moderate paced exercise, right? And that's all they do all the damn time, right? That's only one kind of load to your tendons. It's a very like low force, moderate velocity, strain inducing kind of load to the connective tissues. That's very different than strength training, which is very high intensity, very low volume, very stress inducing to the actual material properties of the connective tissue. So those athletes need to dump a bunch of the volume. They need to build up some tolerance in their connective tissue, and then they need to work back into running again.
Makes so much sense. I think the two things I hear are, one is, people try to ramp up their training, running, climbing, what have you, too quickly, and then the body kind of complains. And then the second thing might be that often we have injuries that might stay asymptomatic for a while. Until you push them beyond an envelope, and then the body just kind of throws its hands up. And I think that's maybe what happened with my shoulder. For many years I kept pushing it, with just some niggles, just some loss in range of motion. And then one fine day, I couldn't raise my arm above my ear. And I think that was my body saying, okay, enough is enough. You have sort of pushed through these other signals I gave you, and now I don't want you to go and do this particular thing anymore. I want you to go and treat yourself. One thing also kind of adding on is, often, Tyler, you're told, hey, listen to your body. If doing something hurts, stop doing it. And I think you pointed at this earlier, but I see that, because I know you often advocate for continuing to practice the sport in certain cases. So let's say somebody, like you said, somebody has like a finger injury or finger pain, somebody has knee pain, maybe elbow pain. And again, when I started climbing, I was told, hey, you're having like elbow pain, rest that elbow, do the other modalities with compression and ice, and then don't stress that elbow for some time, give it complete rest. But I think sometimes you advocate for continuing that activity. So I think you touched on this earlier, but would love for you to expound upon a bit more on sort of how you advise in certain cases to continue the sport.
Yeah, I think in rare circumstances, what I would is considered risky to load like a sports injury. Obviously, like the exceptions would be like shoulder dislocations, ACL tears, full Achilles ruptures. Like there's the obvious, fractures. There's the obvious exceptions to the rule, but most people that are getting kind of pops up one day and it kind of sticks around a long time, those are not injuries that should be considered red or even yellow flags for mechanical loading and physical stress. The type of physical stress, I think, is important to differentiate for the person. Like, it needs to change a little bit in some way, and the dosage needs to change. But very rarely is it like a hard, you shouldn't put load on that thing. At the beginning, if someone has like an acute flare-up, let's say your shoulder, like it's okay to take a week off and not do anything. Like it is okay to, like if the individual feels like makes sense to not load, to let it chill out. I think that's pretty intuitive, and you kind of limp around for a little bit. But if I do that for too long, like the actual quantity or the amount of tissue that's injured in that context is probably not a huge amount. If I continue down the rabbit hole of not loading it, I will lose capacity in all of the other healthy tissues. And so there's an Australian physio, Craig Purdom, who is well known for using the donut hole analogy, I think maybe in the 90s, saying like, focus on the donut and not the hole, and so it's like, there's more healthy stuff than injured stuff. And so you're probably okay to load. We need to maybe change the load to make sure you're loading a lot of healthy stuff. But in that context, it makes people's pain go away quicker than anything, because the pain is not a reflection of the actual extent of the injury. The pain is a mix of all the things in someone's life. Maybe there's some physical pain, but there's like a bunch of psychological stress. There's a bunch of fear. There's a bunch of sleep loss. Like everything gets kind of thrown upside down. And so someone's pain is, because it's not reflective of the injury, it's almost always okay to keep loading them, even in the context of like rotator cuff tears. When people, I've had multiple clients with 50% rotator cuff tears, and they will go, I'll send them to get a surgical opinion, and they always get sent back, and they're like, keep doing rehab. And every single one of those athletes that I can think of off my head are back to loading full strength, doing their sports again. So it's like our body has this massive built-in buffer for being able to like get these injuries, but still adapt to them and still get back to our sport. Obviously there's limits to that, but like that's the exception, not the rule for most athletes.
Tyler, I love that you brought the conversation right back to donuts.
Oh, I always, for sure. That's my vibe, for sure. Yes. If people take like courses from me, I do a lot of teaching, like, and if there isn't like at least 5 pictures of with donuts in them, they'll be upset.
I love it. Well, when you visit San Francisco, we'll have to go visit the some of the best donut shops. We have some donut aficionados in the area as well.
Yes, we might be coming to San Francisco. I think we have a youth course there that Colin's teaching.
So okay.
Sure.
Yeah, we'd love to get some donuts and coffee. Moving on a little bit, again on the subject of specific, let's say, trauma that causes the injury. So you mentioned the rotator cuff stuff, and then it could be maybe somebody, tore the ACL, pretty specific trauma that might have happened. So wanted to juxtapose that against things such as arthritis, osteoarthritis, that some of us start suffering from as we get older, just wear and tear, etc. And I'm wondering if your rehab protocol changes when it is something like arthritis that is diagnosed for one of your athletes.
I think it depends on the person, of course, because some people are going to have more of a predisposition for that, and making sure they don't have like more of the natural kind of inflammatory factor, which would be like the rheumatoid versions of that, which can be, managed with medications and other ways. But from like a mechanical standpoint, there's not a lot of red flags per se for loading an arthritic joint. And in most cases, the science would say that strength training and loading at a high intensity, low volume over long periods of time with slow increases should help like the cartilage as much as anything. So again, it's another one of those, exercise is the best thing we have to a miracle cure. Not a miracle cure, but it's like probably not risky necessarily. Like, and this is really common in like climbers' fingers. Like climbers have ugly hands. All their nuts are all janky looking because they load.
Yeah.
Now the amount of like, I always think about, every time I talk to someone that's been climbing a long time and they have like a finger injury, I'm like, and they're like stressed out about it, I'm like, think about how much stress you put on your fingers over 20 years and you've had one finger injury. I was like, that's they can tolerate so much. All joints. But all matter has limitations. At some point they get some sort of repetitive positional thing that creates irritation to the joint, and the joint gets swollen and the bones get hypertrophied, the ligaments get hypertrophied, the knuckle actually gets arthritis, and other joints get arthritis as a response to make them more stable. So like in the spine, if you took 1,000 people through an MRI scanner, most of that are like above 60, almost all of them would have arthritic changes to their facet joints in their back. And that really is just like your body responding to mechanical stress to make it more protective. So I think on the whole, like managing the pain, I think managing the pain is different than managing the pathology. The pain is people with pathology or findings on an MRI with no pain, they're not patients, right? People that have pain complaints, even without MRI findings or with MRI findings, they are maybe patients, but they need like, not like a bunch of like passive soft tissue things. They just need like a more well-rounded, structured program for their life, more than like a single thing.
Tyler, it was honestly mind-blowing for me as well, because I am one of those specimens with very misshapen fingers, a lot of synovitis on my fingers, and the hangboard protocol, which is hanging on your fingers, for certain lengths, for certain with certain repetitions over time, that really helped me get over my finger pain. So I think for that particular situation with finger range, absolutely, I've given that. I've given the advice to many people, sometimes even unsolicited, because I would see somebody at the crag or at the gym, with like funky looking fingers. I'm like, hey man, if you're feeling pain, you need to get on that hangboard of yours a few times a week and teach your fingers how to gradually accept stress. Is that also true for other joints? Again, the knees, ankles, shoulders, elbows, etc., where perhaps the arthritis is, let's say, end stage. Let's say there isn't cartilage left, and it's bone on bone. And in those cases, have you seen people do well with the weight training type of rehab protocol?
It depends. I definitely don't see as many of those, but I would predict that they definitely are not going to respond to the same volume of like strength training and stuff. Like I would still like promote slow, controlled strength training with modified ranges of motion per the individual, right? Based on what they actually care about doing, which is why for rock climbers, I'm always like, all right, cool. Let's find a way to keep you loading your fingers to make you feel and know that you're still a rock climber, because loading is okay. Because if I give a bunch of exercises to someone that does not care about the exercises, the research shows they don't really help people. Just generally. That's the problem with like the rehab world, is people selling the idea that this thing is good for this pathology. But if the person doesn't give a damn about that, it's not a very good choice for that person. So I think those people need to be like managed more tightly than most of my clients, who are like pretty well kind of navigated on their own, because they're not going to have the same capacity. But most of the orthopedic surgeons that I know, or people that work in like the prosthetics, like replacement space, would say you do not want to get those kinds of things unless you absolutely have to. So at some point, if you really are bone on bone in the knee, like getting a knee replacement is like an okay decision and a personal decision for people, because but some people will tough through it for a really long time. Like hips are the same way. Hips, most doctors will say, don't get a hip replacement until you can hardly walk and the quality of your life is really suffering. And so I think a lot of people get scared of pain and fearful of pain, and that kind of drives not doing things because of the fear of pain. But like, it's not until those end stages where it's really self-limiting that you need to be overly concerned about it. But most of the time, that's again the exception, not the rule. But again, I don't work with people over 60 that much. Certainly that's the population that are getting end stage arthritic changes.
Got it. Tyler, one thing I think myself and a lot of your other followers or patients or what have you love about you is you dog food your own training. And by that, what I mean is you're a talented and dedicated rock climber yourself, and you're always out there experimenting on different types of injury prevention, injury cures, and other kinds of training methods. One thing I believe you went through in your own life is I think you had some debilitating injuries yourself, and you managed to rehab and get back to form. So maybe just if you want to just quickly share what happened with you and how did you prove the diagnosis or rather the prognosis wrong and get back to doing what you love.
Yeah, my case is super interesting because like it's kind of the equivalent of dogs that get hip dysplasia. Like humans can get hip dysplasia. And so most youth athletes will experience a risk in experiencing symptoms or making their symptoms worse, or actually getting injured when they go through their growth spurt. And so I played baseball my whole life, I wrestled my whole life, and I played football. And like when I was a little kid in elementary school, I was super fast, like always the fastest. I could beat people in races. But then when I went into junior high school, I just couldn't run fast. It was weird. I remember just being like, why can't I run fast anymore? But I didn't really have hip pain that I remember. But it was definitely like a change that happened to my hip that was being expressed in that maturity phase when my bones were starting to grow and fuse together. So essentially the left hip is like the hip is a ball in a socket joint. And people is like the ball is spherical and concave, and then the socket, I'm sorry, and then the ball is just like convex and round. And so they fit good together, and there's ligaments around them, and there's muscle, like this range of motion, right? It has a pretty good range of motion. Mine is not built like that. Like my hip socket is bigger and flat, and my ball or my femoral head is square. So like my range of motion on my hip has never been good. Like I've known that since I was, I tell my wife, like I could never sit cross-legged as a kid on the ground comfortably ever my whole life. And so like when I was in, so that was kind of like the story that maybe didn't get seen when I was a kid, you know? And so then when I went to college, after my bones were done maturing, like my hip and my back started to hurt all the time. And it didn't really present like hip pain, it presented like back pain. And so with that limited range of motion, like there's nothing I can do about it. But I got some advice from people, and I would go like complain about it, and I would get advice. And the advice was always kind of the cliche, oh, your back is tight because your hamstrings are tight, or your back is tight because your core is weak and you need to strengthen stuff. And so it was the kind of run you down the typical, like essentially bullshit biomechanical explanation for low back, when no one really did a thorough sit me down and talk to me about what's going on. Because I was super active, like was climbing and backcountry skiing and going to concerts with my friends and painting as my job, going to college. So my life through college was just like, I'm a good example of I was just really tired all the time. And when you get really tired, like your body is like an ecosystem. And so when I get really tired, my hip is always the thing that hurts, always, still to this day. But it kind of presents like hip and back pain, right? But I can do a lot of stuff. I can climb, I can go backcountry skiing, I can lift weights with modifications, but there's other things that I can't do. I can't stand on flat ground for a long time. That always makes my hips sore. I don't like walking for long distances. That'll make my hips sore. I can't do like squatting or deadlifting. That will predictably make my hips sore. So it's like there's these things that I think are important for people to understand, that you do have some limitations to your mechanics, and there's not a whole lot I can do about that. But the information that I got, or the advice that I got, was not personalized to me, because it was just like, they have this pain complaint, here's what you do. And that's such a cliched, outplayed waste of people's money, and it super pisses me off when I hear getting that from healthcare providers, because all someone had to do is take an MRI, right, and take more of a picture, take more of a look into it. And so I had an MRI recently. My hip is jacked, like, but it's not that hurt, right? Which is like I think I'm a really good example of, if you looked at my pictures on an MRI, you'd be like, that person must be miserable. They must have a lot of pain. But my hip hardly hurts at all, because I know which I can tolerate, and I can still do that I love and not be miserable.
Yeah, no, I think you've really learned / taught yourself to listen to your body and be very specific with what you subject your hips to. And I think over time you have kind of fine-tuned those activities that your hip can thrive in, and reduce, or sometimes maybe eliminate others which clearly bother your hip. And I think there's a lesson. I think some of it, I think all of us as we get older learn on our own. Some of us who are more self-aware, they do it faster. Some of us, it takes more time. But I think that's the key thing, which is one can still continue to do a lot of things one flourishes in, and minimize others. One thing that I always find fascinating is some of the elite athletes in our sport, the ones who are out there, breaking records, doing first ascents, whatnot. What are some of those things that, again, these elite athletes are doing? The best rock climbers, surfers, runners, etc., that the rest of us are not doing for both injury, observation, diagnosis, rehab. Any comments there?
So yeah, this one's like really tricky, and I have, like, your viewers won't see it, but I have this like paper sitting in front of me. Essentially, it's like this one's a 2016 like International Olympic Committee consensus statement on load in sports and injury risk.
Mm-hmm. Mm-hmm.
And so it goes through and it talks about things that are considered internal loads and things that are considered external loads. So the internal loads are social stress, sleeping habits, diet, other healthcare factors, other risk factors, family history, etc. And the external loading is like all the physical stress with our sport, the dosage, the intensity, the volume, the recovery, etc. And like it all matters for the athlete and their ability to adapt. When we come down to like the absolute significant difference between why professional athletes can tolerate more, it is genetic. Like discrediting their work ethic or discrediting their skill set or discrediting what they do. But from my experience, most of the time in our space, the professional athletes, they give the worst advice because they don't understand really why it works for them or how they're good at what they do. They just like do it, right? And the difference that these papers would validate is that those athletes literally can tolerate physical stress than other people can. And that's a connective tissue thing. Maybe that got built a little for that person, but what really differentiates the playing field with the most elite and the average athlete is for sure something that is without, outside of the control of the individual. Which I think that's like very maybe un-American, and people are like, oh, that's not true. Like you want, and I think that's cute and whatever, but I think that's naive as hell too. Like because like examples like Michael Jordan and LeBron James and Kobe Bryant, those athletes have been killing it since they were kids. They didn't do shit different than someone else. They just were better, just like physically better. Same thing for the climbers. The athletes that are training the hardest can do more just because they can. And so I think it's really maybe important for everyone else to appreciate that, because if you try and train like them, you're going to get hurt. And that's the downside of that. Is I talk to all the people who work with pro athletes that don't give good suggestions and they get hurt because that athlete doesn't really know. In their defense, they don't really know how much a normal person can tolerate, but their prescriptions tend to be over the top, a lot of times. And that's not to say all of them, but that's pretty common in all sports.
No, I think that is a hard truth, that some of us are just born with gifts that the rest of us don't have. I remember many years ago hearing some comment by Dave Graham, and Dave Graham was being asked about how he managed to keep pushing the hard bouldering envelope for so long. And I think one of the things he said, which I thought was really interesting, he said he's taught himself to stay on the verge of injury, but not get injured. So I think it's probably a combination of just genetics and having the body capacity, the connective tissue, and maybe just some ESP, where he's able to really understand what his body is going through and push until he cannot push anymore and then stop there. And
I think maybe a really important thing too is everyone wants to and professional athletes work their ass off, right? But so does like the weekend warrior. Like I know so many athletes that care so much about climbing, they work their ass off too. And so the pro athlete, just because they have more time, they're doing more, their effort matters more. That's not the case. Like there's a lot of people that put in a lot of good effort and try really hard and do all the right things, and they just will not get the same response as the elite athlete.
True.
And that's just like kind of a hard reality of our world, And so like I have, maybe because I'm 42 years old and I'm not a professional athlete and have a job, like that doesn't hurt my feelings really. But for young kids, maybe I could see how that would kind of a stamp down on your thunder, right? And that doesn't mean that you don't want to keep pursuing your dreams and your goals, whatever. It's like, but being realistic about it, I think is also, a very helpful thing for just the average person.
Tyler, what are some of those most common things you see that concern you, where you feel, these are things that athletes should not be doing? You just keep seeing the same things over and over again. And maybe some things that you feel they should actually start doing, and they seem resistance to change.
Ooh, climbing world's super resistant to change. I don't know if there's like things that I would say are for sure hard they should stop doing, because we don't have that much evidence to support anything in rock climbing, really.
Mm-hmm.
There's very low quality research and quantity of research, and that will change over time, of course. I would say maybe the most risky behaviors are really just climbing volume, just like doing too much too often. That will certainly stale progress. That will certainly increase injury risk. But that's not a single thing, but that's a mix of all the things. I would say probably the most useless thing that climbers do is a lot of calisthenic types of exercise stuff, like body weight stuff. Like just naturally climbers are strong. Like their upper bodies are strong stuff. And so they're naturally good at other things. And so one of the rabbit holes that we get ourselves into, that other sports did too, but now they have the research to say don't do that, but climbers don't have that, is they try and replicate movements or positions or things that look like rock climbing things, and they do them off the wall. From like the ability to adapt and get something from that, we can say that's pretty much a waste of your time. Like that's not strength training. That's not your sport. That's not end range stretching. That's just kind of a skills acquisition for something that you hope transfers to your sport. But there's very little guarantee that the coordination of something that's not your sport will actually transfer to your sport, right? And so when it comes to strength training, the recruitment, the tendon stiffness changes, those are the things that we can say pretty confidently, those should transfer to our sport. But we still have to practice our sport. But there's a lot of like the crossover between gymnastics is beautiful and strong and rock climbing is beautiful and strong, and we love each other, so we like, but climbers do all the gymnastics shit, but the gymnastics athletes are not rock climbing for their training. So we're kind of like obsessed with like trying to be like this other sport that is maybe stronger than us. I don't know. It's a very weird space, but climbers like that kind of stuff.
As climbing enters the mainstream, Olympics now, and you find even federal governments are starting to actually recognize the importance of climbing to maybe as something that a lot of people engage in and starting to put money into it. You of course are leading a lot of the research in training, and I think there are others as well. What are some of the things out there that are going on with training and again injury detection, rehab, etc., that are being done with elite athletes that the ordinary person out there can at least get insights on or learn from or take advantage of?
I don't know, with the exception of like maybe the German team. I'm sure Alex Megos and Adam Ondra, I'm sure they have a team of like specialists like watching them closely. I'm not sure that someone does that regularly in the States that I'm aware of. Like maybe some. I know there's one doc that's a medical doctor that's doing like some cardiovascular stuff. And in terms of like the research, like I don't work at a university anymore, so I don't do much like peer-reviewed research like for my job now. It's mostly just like applying sports science ideas to climbing and better understanding it. And so hopefully when I was in graduate school, like doing research is interesting, but it's kind of boring. That's not really what churns my gears. Like I love research and appreciate researchers, but my brain is too not scattered, but it likes to move on and do new things other than like, this is the one thing we're going to do for the next 3 years. So I want like hopefully younger kids coming up and getting like their master's degree in exercise science that care about climbing. They're the ones that are going to keep pushing like the good research moving forward. But I don't know that there's like, from my perspective, I would say being able to measure force, and this is something that I'm known for, is like measuring force and measuring velocity are methods to detect fatigue. And
Mm-hmm.
using a fingerboard is like a little bit harder to detect fatigue. And that's kind of like the recent 2.5 hour podcast I did with Steve. But those kinds of things seem like groundbreaking, like life-shattering kinds of things for climbers. But that's not that complicated, nor is it that like sophisticated by any means. Like other sports have been doing that for decades, right? And so like being able to understand the amount of fatigue you carry from session to session is probably the most helpful thing that the average athlete can do for themselves. And so essentially what that means, and it doesn't need to be sophisticated, like the strain gauges, like the Tyndek progressor that I use and promote is inexpensive. It's like $150. The true encoder, the LPT, which measures velocity, that's a little more expensive. Those are like $400. But using tools like that allows the athlete to make sure that they're prepared or rested for their training session. And the training session is going to be useful, and I guess useful in the context is they're going to recover from it, and so they're going to get an adaptive benefit from it if they do it when they're not tired. Like most people are just like doing too much stuff, and their sessions are just subpar quality. The quality is just not that high, because we try and like apply the same frequency of loading to climbing as we would other sports. But if you think the size of the fingers and the size of the knee, you can't climb as much as you can play soccer. You just can't. Like the fingers will limit how much volume you can do. And so one of the things that I do quite a bit of is teach like at the CWA, or teach, like I was at the Canadian Climbing Symposium this fall talking about like finger training things and how we can maybe think about them differently to make us less injured from them, but gain an adaptation. But then also youth climbing injury risk is something I do a good amount of teaching with. And I'm not sure if I've fully answered your question, but there's not really that much sophisticated stuff going on in the climbing world that I'm aware of.
You did, and in fact, you partially helped point us towards my next question, which is related to quantified health for climbers and for our kinds of outdoor athletes. So we have seen improvements in quantified health used by the everyday athlete out there. People are using different devices. People are studying data. People are monitoring energy output, sleep. People are recording those things in Strava and what have you. What is the state of quantified health for climbers? Because, for example, I see people logging in their climbing activity on Strava, but to me, it doesn't really mean that much, because they are manually entering that data instead of having Strava or another device record important data points about their climbing session and their climbing performance over time. So, yeah, would be curious on what your take is on advancements in quantified health that people are taking advantage of already, or should be taking advantage of.
I don't know that there's much that people are taking advantage of that's really precise and that accurate in terms of, or that sensitive as a measure for what they're getting out of their training sessions. With the exception of athletes that are like using, let's say for finger training, they're using some sort of measurement device to calculate their loads all the time. And so one thing I use for my training is I'll use the power meter to measure and quantify my strength training stuff, my non-climbing strength training stuff. And that gives me a pretty good range of adaptation over time. But I would say like there's nothing really that's that powerful and or like useful. Maybe the sleeping habit stuff, but those, like wearing an Apple Watch is not that precise of your sleep habits. Something like the Whoop strap would be better. But like it's really hard to predict human performance, just period. Like there's fancy tools, and a lot of times the fancy tool becomes the focus of the thing. I usually tell, and we did a podcast maybe a couple months ago with my coaches, and like one of the questions that was asked was like, how do I know my training program was effective? And the next time I do a training program, how do I know what to change? And that's like a multifactorial thing. But my response was like, did you get hurt? right? Like what was the consequence of your training program? Like, did you have a season that lasted the amount of time you expected it to, and was your average performance high quality? Like, did you try hard? Did you get hurt? How was your sleep habits? Like, what was your overall well-being during that period of time? And most people that like, I got hurt at the end of my training program. It's like, you probably doesn't mean your training program was bad. You maybe pushed it too long. People that got hurt in the middle of their training program, your training program was too much volume. Like, you can't do that the next week. Right? So I think we can also use, like, humans are not dumb. Like, athletes are not intentionally doing shit to hurt themselves, but they know when they're overdoing it. But if we don't educate people that it's okay to not do the plan as it's prescribed or go off the plan, like, that's a mistake on the coach's part, because I don't know if athletes are going to adapt to every training session. Why the hell would I? That doesn't make any sense. They don't know either. So they have to, like, know that your sessions are not the same quality. Your sessions are not the same volume, right? Like, teach the athlete, and the athlete's got to learn kind of to get a better sense of what they can adapt to, and that changes over time too. So it's like,
got it.
It's got to be like,
the athlete listening to themselves, and then their coach also providing that prompt feedback on adaptations that they need to be making. Many years ago, I remember a kind of a well-known climbing trainer, Justin Shong. He would be out at the crag wearing a heart rate monitor. And the way he would instruct people to use that thing was that they should listen to the HRM to tell them, hey, if you are at rest on a long climb, it will tell you when you should begin climbing again, because your heart has now, slowed down to a certain level. Do you see people benefiting from HRMs in their training, or actually while they're performing as well?
I mean, I don't know that many people do that. Like, I think maybe in the most rare cases that happens, like, I have certainly heart rate monitors and what are called SMO2 monitors. So I can put heart rate monitor on someone's chest, and then also an oxygen utilization monitor on their forearms. And you can, but the problem with that is, like, and it's really interesting, because when it comes to, like, fingerboarding, you'll see, like, a drop in oxygen use when they are doing work, and then you'll see it come back with it. And they'll do that throughout the repetitions. Even when their muscles are not recovering, they can still do repetitions, because the types of muscle contractions used with a fingerboard. So it's pretty damn insightful, but those things are $2,000. Climbers are not investing that much money in that kind of equipment. Like, and it's even, like, hard to sell to the larger, like, community, because, like, I've tried to do this multiple times with our team and say, hey, I'll do this for free. I live here. Like, anyway, I'll do it for free. And there was interest, but there was, like, little follow through. So it's like, the team's not big enough almost to, like, be able to have enough eyes exploring all the avenues that would really help our athletes. So we could use in that context, which for sure, but they're not being used, which is kind of a bummer.
Great. We are moving to the end of our session, but before we do that, just one last thing on this topic, which is when you look at the future of training, the future of rehab, what is it that you find most exciting? I mean, do you see, AI coming in and giving us some valuable tools? Something else that you're really keen to see develop?
I think the like AI example would be, an AI could give you, like, a generalized crappy training program that's very generic, but the AI can't really understand and care for the person enough to, like, educate them on an emotional level that's going to be meaningful. Right? Like, sure, make me a finger training program, whatever. It might work great. Might be too much volume, but easy to adjust. But they can't really sit and, like understand the person's emotional response and how stressed they are about a pain complaint and how that stress is influencing their training and how they need to adjust that. So I think in terms of being really precise, I think I've always been a fan of like letting the principles of sports science guide the kind of direction that we take, but the art of coaching is like not that simple. The art of coaching is really what makes coaches and healthcare providers exceptional, because they have to connect with people and they have to think on their feet and they have to like not freak out when the client is freaked out, right? And there's all these other factors that I think AI is not going to be able to do very well, at least anytime soon. But I don't know that much about that world. Maybe they do. I don't.
Sure. Yeah, I'm curious. I mean, one thing that, again, climbers being a little bit more hippie than other sports, maybe we are not so good at, which is keeping detailed records, data about training and performance, which maybe today does not provide sufficient reserves for like LLMs, large language models, to draw upon. But I'm curious if that changes. We are able to. I'm positive this is already happening in other sports, and I'm positive that maybe give it 5 years, 10 years, more money comes into the sport. People will start recording their data, and in that spectrum between coaching and training being an art and a science, we'll probably see some shifts happening towards the science spectrum, and maybe even people, experts such as yourself, starting to maybe leverage a bit more AI in helping maybe fine tune or inform training.
Yeah, that'll be interesting for sure. I'm assuming that will happen.
Great. One thing one or two last questions before we wrap up. Any favorite climbing training book that you love, or maybe another kind of training research? I know that when I started climbing, we had just a few books out there, Performance Rock Climbing, and then I think Eric Horst had a couple of books. But now there's so many other books people are putting out. So wondering which is your favorite climbing training book? And then I also like to read. And then secondly, just for fun, what's maybe a great climbing movie that you watched you would recommend?
So I can probably say I don't read books very often. Like the downside of books is they're outdated too fast. Like things change, and I think a lot of with the exception probably of Eric Horst's book or Steve Bechtel's book, like those have some quantified. I guess the old Rock Climbing Trainer's Manual has some science stuff too. It's like, but those things are like things change so fast, and so I think I've probably never completed a full rock climbing book. Looked at pieces. I think probably Steve Bechtel's book is probably one I've read the most. And I forget which one. I have a couple of his that I think are good. Metal, I think, is a good one, but that's not as much like a training book as it is like a kind of informative kind of skills discussion kind of thing. So I read research papers more than anything else. And if I'm not like research papers, like I'm not reading climbing shit. Like I actually don't watch like climbing competitions with few exceptions, or professional athletes climbing, or YouTube videos of athletes. Like I think like it's been kind of good in some sense to like make my exploration of the science and modifications kind of seem organic for me based on what I like read and learn and kind of explore, so I don't do a ton of that additionally. For climbing movies, geez. I do like just kind of like the real rock movies, just like the people pushing it. Like I like that kind of stuff. That's awesome. Like I love big wall climbing. Like to me, the purest, most interesting, exciting thing about climbing is big wall climbing, or
Sure,
fine style climbing. Like I don't like sport climbing that much for some reason. I like bouldering because it's pretty hard and it's sort of natural and you can kind of do it right. I don't love sport climbing for whatever reason, but I love the big wall adventure kinds of films for sure. Like I love that movie, The Alpinist. That's probably the one that I've seen the most recent. That's the most badass and awesome.
I hope you got to see it on the big screen. I know I did, and even with some idea of what I was going to expect, those opening scenes with Mark
Unbelievable.
Henry Leclerc, just like free solo on-site ice climbing. I mean,
What an amazing athlete. That's so incredible. It really is like a feat of athleticism that like is far beyond anything I will ever do. It's amazing, right?
Yeah,
Because I've like done
even maybe even beyond athleticism, a feat of human endeavor. I mean, it's just I think it's beyond athletics. It's like a human being capable of that kind of performance. It's unreal.
Yeah, it's as close as you're going to get to like a superhero status, right? As a human, I think like people don't do that shit. You don't just like walk up to an ice cliff and climb it with no rope. Like that's just not something that humans do. Like Honnold's like solos are incredible, like, and those are amazing to watch. But he's very rehearsed and like kind of does it more strategic and planned, right? Like that thing was like not. I mean, I think he did it solo, right? And then he went back to film it, but like the ice changes, not a consistent the conditions, right? So the kind of takes the scare factor and cranks it up a little bit too, So
absolutely, and I mean, not taking nothing away from Honnold, but Yosemite granite is maybe a little bit less brittle than British Columbia ice.
Yeah. I mean, those routes are like so well rehearsed, and he knows them so good. Like he's the other level of amazing athlete for sure, no doubt, like unmatched, But it's like it's a little bit just like a little bit more edgy, a little bit more metal. The Alpine ascent. That movie got me gripped for sure.
Yeah, next level inspiration where I have no guilt on sitting on my couch and eating popcorn while I watch that climbing action.
Yeah.
Tyler, I think most of us, you're pretty well known on the interwebs, but those of us who don't know where to find you, could you point us to how people can find more info on what services you provide to athletes? And then also one thing I think you do is also quite valuable if you still do it, which is I think you were hosting in-person training workshops or measurement workshops at some point. If you have any of those coming up that people can find out and sign up early, because I think those sell out pretty quickly.
Yeah, those things are fun. I haven't done as many of those. I did a lot last year. Like I did every month I traveled to teach. And it was like a lot of load. I have like 4 kids, so it's like, I'd like to be home from my family. So I did a lot of that last year. I probably am not going to do much of that this year. Certainly do lots of online teaching, and I have online courses too that people can just buy on the website. We do have a youth like certification course, so maybe people that own gyms and like want to like train their youth climbing coaches about strength conditioning principles. We have a course that we teach 2 days there that we are promoting and getting traction for and accepting interest in. And I think we have like 4 scheduled this year, but we can fill that up where I maybe will teach some of those. Colin usually teaches those. And then people can find me on Instagram is like something I use enough, but I'm starting to get away from. I've used it for a long time, and I'm kind of over that platform in some ways, but I will still be there and I answer messages, whatever. But there's all my information for YouTube and Patreon account and website on Instagram as well. So I don't use Facebook or Twitter or other platforms, mostly just Instagram and YouTube and Patreon.
Got it. Instagram and YouTube, and then I think if people want to book private
they can
coaching with you
or on
your
Instagram.
website, right? Yeah, we'll make sure to post those links. One on topic of camps, actually, I found this always a little bit annoying that when you go to the climbing gym, right? You're a youth athlete, you're a kid, and there are these daily, regular, like whatever training program set up. On the other end, if you're an elite athlete, again, you have the ability to go into immersive coaching programs. But let's say you're just a middle of the road but obsessive average athlete. You often have to be self-coached. So I'm always interested in hearing about training workshops, immersion ones that people are doing, where they can, people such as myself can just go to some place in Salt Lake for a month and just be trained with good coaches, and also have the camaraderie of other athletes around them. Anyway, that's another topic to look into, and I hope somebody out there is thinking of doing those kinds of camps for the rest of us.
I'm sure people do that stuff for sure. Like, I know it happens at like the USA like coaches training camp and like at the setting level they do, but something that's crazy interesting is like in the climbing world that we're trying to maybe nudge a little bit more is like, to be a youth climbing coach, you don't need any sort of credentials other than a little bit of street cred from the gym and people like you and you're a good climber. Like those are the requisite things that you need, right? But in other sports, that's not enough. Like you can't do that if you're a high school soccer coach or a high school, which like there's no way in hell you're getting that job unless you have something to support that you know what you're doing, right? And not to say that they don't know what they're doing from a climbing standpoint, but prescribing things and making good decisions and like helping the individual on a physical level as best they can requires more nuance. It requires more education. So that's kind of the impetus for that course, is to try and help equip youth coaches have a bit more understanding of sports science as it applies to training a rock climber, a youth climber.
That is absolutely the way forward, though I would say as an old school climber, I sometimes have mixed feelings about our sport getting a little bit formal and commercial. But no, I think that is the right place for climbing to be evolving into.
Well, I mean, the problem is like most of those kids aren't going to grow up. Like my kids grow up and they go out with me to the desert and we go like scramble and climb and do stuff. Like a lot of those kids don't do that. They grow up in a gym climbing, and they just see what the big kids are doing. They do what the big kids are doing, whether that's a good idea or not. Most times probably not, but they can still do things. So it's like, it's kind of a hard like space to navigate, but so that's something that I think needs to happen for the sport to like evolve and for athletes to, be able to progress in a healthy way that's going to be long-term sustainable for them. And like, but, it's kind of like a necessary thing that's going to be slow to adapt and equip ourselves with, where like, like approach the USA Climbing 2 about that and like say, hey, you guys are interested in this, we'd like your support, whatever. And, it's again, kind of like a balls on deaf ears kind of things. Like, yeah, sure, send us your stuff. We'll see. It's like, no, we're not going to do that. We're going to kind of go in the other way where we're just going to go, because I like teaching and so does Colin. We're just going to go educate all the coaches around the country and then be like, oh, wait, we should probably support this thing because it like is what the coaches really want kind of thing. So it's like, but another topic. But yeah, I think that needs to happen.
Absolutely. Dad, you have so much. You're such a fount of knowledge. I could talk to you all afternoon, but I know that you have things to do, so I will let you go. I think it should still be daylight in Utah. I hope you get to enjoy some outdoor time with your family. Thank you so much for coming on the show.
Yeah, you're welcome. Thanks for having me. It's great to just kind of chit chat about lots of different things.
Absolutely. Thank you. Take care.
Yep.